Good morning, friends. So this morning we are going to chat about do not resuscitate orders, or a DNR, and what that really means. Good morning. My name is Michelle Ledbetter. I am a hospice and palliative care certified registered nurse, and on this station we talk about life and death and any topic that comes up around that. Thank you so much for being here with me this morning. You know, one of the biggest misconceptions that I hear is that if I sign this do not resuscitate order, that the hospital's not going to treat me anymore. That is not what a DNR means. A do not resuscitate order only implies that if your heart stops or you stop breathing, it tells the healthcare team not to perform CPR or advanced life support in that specific situation. A DNR does not mean that you're not going to receive pain medication, that you won't receive oxygen if it helps you, that you won't get treatment for an infection, that you won't receive IV fluids if it's indicated, that you won't receive comfort, compassion, or attentive nursing care. If something were to happen, you're in the hospital, you become dizzy, you faint, you have low blood sugar, you develop an infection, or have another potentially reversible medical problem, your healthcare team should assess you and provide appropriate treatment. So why do some people choose a DNR? Here's the truth. Because CPR is not a gentle procedure. It often involves forceful chest compressions, may require a breathing tube, medications, electric shock. In people who are frail or have an advanced illness or near the end of life, CPR is much less likely to restore meaningful recovery and it can cause significant injury, and often does. Typically, people that have CPR towards the end of life do not come back to the baseline that they were before their event. So for many people, the question isn't simply, can we restart the heart? It's what kind of life are we what kind of life are we trying to return them to? Choosing a do not resuscitate is not about giving up. It's about making sure that medical care reflects a person's goals, values, and wishes. These are deeply personal decisions, and there is no one right answer for everyone. The most important thing is that patients and families understand what a DNR does and does not mean, so they can make informed decisions without fear. You know, I believe that education can reduce and sometimes replace fear, and conversations can create peace around this topic. If you find this information helpful, I would be grateful if you would consider subscribing, following, and sharing. It helps move the algorithm along so this information can get to more people. And again, my goal here is just to help reduce some of the fear that goes around the topic of dying and death. Thank you so much for being here. Until we meet again, be kind to one another. Bye for now.